Hey everybody, welcome back to another episode of Ask Kati Anything. I'm your host, licensed marriage and family therapist, Kati Morton. I'm so glad that you're here. In today's episode, I'm going to talk about a lot of things, starting off with repressed memories, why they happen, and whether we can recover them or if they're lost forever. Then I'm going to jump into the process of discovery and acceptance when we receive a new diagnosis and kind of what that looks like. Then I'll talk about what inspired me to become a therapist, and how to know if what we're suffering from is really depression. Finally, I'll discuss the ways that we can ask our therapist to help us ground, like let's say we need touch or something like that. How can we ask for that when we're dissociating? And how we can ask our therapist to maybe shift the way that they're treating us. Without further ado, let's jump right in. Question number 1 says, "Hi, Kati, I hope you're well." I am. I hope you're well. Can you talk about suppressed memories? In suppressed and repressed, I'm going to use these terms interchangeably, essentially memories that aren't fully accessible to us at all times, okay? My dad died when I was young. I was in the room, but I'm missing huge gaps in my memory. Why does this occur? And why only parts of the memory instead of the entire memory? Are there ways to help recover those memories? Thanks for all that you do. First of all, I'm so sorry for your loss. Losing a parent. I've lost my father when I was, how old was I? 24 when my dad died. It's really hard, and I'm so sorry. However, when we talk about repressed memories, losing a parent like that can be overwhelming, to say the least. It can be traumatizing. It can be completely intensely stressful. Like I've shared this before, but when my dad passed away, I was in graduate school and working full time, and I just had so much shit going on. And I remember, it's not my proudest moment, but I remember at the funeral home talking with them because we weren't doing an open casket or anything like that, and being pissed about the cost. They're like, well, it cost $100 for us to put him in clothes and $100 to put him in a shroud or something. And I was like, you guys fucking are the worst, making money off of people. I just lost my mind. And it was because it was so intense. It was so stressful. I was so grief-stricken and just overwhelmed. And because of all of that intense emotion, it can be too much for us to process in the moment. And it's very possible that you dissociated. Now, for those of you who don't know, dissociation is essentially our brain pulling the ripcord on reality. It pulls us out just enough that we're not in it completely. It almost gives us distance between ourselves and the stressful situation. And in that distance, we kind of like feel more protected, right? We're not as emotionally or even physically connected to the event while it's happening. And when we dissociate, there can be gaps in memory. And that's what I would assume has happened here. It was really stressful. You were in the room. Seeing your dad like that is really difficult. It's hard, especially, I don't know if this is how you feel, but for me, my dad was like such a big, strong guy, and I thought I could count on him forever and he'd be there forever. And then to lose him and to see him sick and getting sicker, it's hard. And so it's possible that you dissociated. And when we do dissociate, sometimes our brain never forms the memory, meaning it really can't be retrieved. But for others of us, we do have bits and pieces of the memory, meaning that we might see flashes like flipping through a photo book, or have like just like a second glimpse of it, or like little chunks, but we don't have the full story. And it all depends on you, what was going on with you in those moments, okay? And I say all of that because there are ways that we can recover repressed memories or suppressed memories, whatever you want to call them. And the main way is therapy. When we talk it through, when we try to talk it out, when a therapist helps us by asking questions and giving us a moment to answer them and all of that good stuff, in that process, we can sometimes, if the memory exists, we can sometimes uncover them. We can suddenly remember. I also find personally, when I don't fully remember something, maybe because it's been a long time ago, or maybe I was dissociated, right? Talking to other people who were present in those moments can help me retrieve them. So like my brother can be a good resource, my mom sometimes, Sean sometimes, just depending on what it is I'm trying to recall. They might remember other details or other pieces that I don't. And that can be really helpful too. I'm like, oh yeah, I do remember. Or, oh yeah. You know, it kind of helps you piece it together. And so talking to a therapist, talking to people who were present can be really helpful. I also want you to know that that sometimes we can't recover them. And that may involve like this grieving process for you. It may mean that I don't know, we could feel all sorts of things as a result. I don't want to like tell you how you're going to feel, but know that that's okay too. And that's where therapy can be really beneficial. And also journaling can be helpful here too. I don't want to forget about that, because as we write out things that we recall, sometimes it can bring other things up. But overall, the last part of your question, why does this happen? It happens because it's too much in the moment for our brain to process. And we dissociate or check out or whatever you want to call it to get through the troubling, stressful, overwhelming situation without completely breaking down and falling apart. It's protective. It's the way that our nervous system is wired to try to get us through. And yes, for some of us, it can be overactive and happen when we're really not under threat and things really aren't that bad. But for a lot of us, it is when things are really difficult. And it's our brain and body's way of like protecting us from a psychologically overwhelming situation. Okay? Again, I'm so sorry for your loss, but I hope that was helpful. Let's move on to question number 2. Question number 2 says, "Hey, Kati, I've been going down the journey of realizing that I'm autistic for a year now. I'm a 40-year-old female. I was just reading a research article and then I listened to a podcast. I went down my own rabbit hole about women getting diagnosed so much later. I'm so sorry that it took so long for you to get diagnosed." Okay, so I've been going down this journey and the navigation of the grief of what I thought were things I could overcome but struggled to do, and now realizing I will never overcome some of my issues ever. I don't even know how to approach family with my realization of myself and feel even more alien with people now. I feel overwhelmed and I'm unsure if I really am or not, but I did make a list of 50 memories that could point to it. I don't have the funds for an official diagnosis either. Oh, gotcha. And just wanted to know what a therapist might say about such a wishy-washy feeling of oneself over this rabbit hole, quote unquote, discovery. Thanks for your podcast and answering questions. Love all you do. Of course. Happy to be here. Okay. First of all, obviously, I have to say this, that getting a proper diagnosis is key, because there are things that even if we completely spiral and do all the hyper-focused research and listen to all the podcasts and read all the things, we may not know, or we may misdiagnose, or we may see some overlap with like things like ADHD, for example, that could make it look like we have autism when in fact we have ADHD, or vice versa, right? So getting a proper diagnosis is ideal. However, when we're doing what I would call internal research, we're trying to better understand ourselves, figure out what the hell we're going through and why we feel the way we feel, right? We all kind of want a little bit of, I guess validation is the best word, but it's also just a name to put to what's going on. And that can feel incredibly affirming, okay? And so if we think that what we have and what we're dealing with in this maybe struggle that we've had in our lives is autism, my best advice for you is, number one, to get connected to a community of autistic people. Because I want you to see and know that it's not as gloomy or limiting as it feels like you might be thinking it's going to be. Now, obviously, you're 40 years, you're like my age. You've had a lot of life experiences where maybe things didn't work the way that you liked, or your relationships didn't develop in the way that you had hoped, or you always felt a little disconnected or something, right? Throughout your life, you've had a lot of that experience. I don't want to minimize that, but I also want you to know that living as an autistic woman can be a wonderful thing. It doesn't have to be so limiting or so terrible. And a lot of people in the autistic community, I think, would, agree with me here that we have to work with, not against our brains. And so queuing in and getting connected with those communities can help you utilize tools that others have discovered through their own trial and error. And that can be incredibly beneficial, okay? So that's like my main piece of advice through this whole thing. But what you're really asking, and I want to respect that, the real question is, what would a therapist say with someone who's kind of in this self-discovery rabbit hole of diagnoses? Overall, when it comes to this process, I always encourage my patients to do some, psychoeducation, which really is just a fancy way of saying learn about the thing that you're struggling with. I always want to encourage people to do that. And obviously I want to make sure that it's like credible resources and stuff like that, but I want people to feel like they can learn about it so that they can decide what signs and symptoms apply to them most, which rolls into what I would do if you came into my office and you were telling me this, hey, I think I'm autistic. I would want to get a sense for what symptoms or signs or things, behaviors, whatever it is, are bothering you the most, and find ways to mitigate that or work with your brain to kind of remove that barrier or that struggle. Does that make sense? It's almost like if the main issue for you or the thing that you feel like is the biggest is like, oh, I always feel like misunderstood, or I don't feel really connected, then those would be the things I'd say, okay, what would connected look like then? And how would we know if we were connected? And it would help you understand the way that your brain works and offer some other ideas for ways that you can get reconnected, and some maybe behaviors or things that we can try and see if they feel authentic. I don't want everybody masking. I know that's exhausting, but you know what I mean? Just finding ways to feel connected. Can we find someone else who has the same interest that we have? Let's say we find ourselves like super hyper focused on learning everything about guitars. Then can we find somebody else who's a total guitar head and spend time with them? Is there a way to find those people? You know, things like that, working with our strengths instead of focusing on our weaknesses. And so I think that would be a big piece of it. What symptoms are bugging you the most? And then also you said the navigation of the grief. I would want to give space for you to feel like you could be sad and you could be disappointed and you could be frustrated and you could have all the feelings of whatever that comes up for you. And maybe journaling could be helpful if you can't afford therapy right now. But I would want to make sure that you feel free to feel however you feel. If you want to feel ashamed or mad or sad about it, you have every right to feel that way. I just always have to tell you that, like, having a diagnosis, if we got properly diagnosed, having a diagnosis of autism spectrum disorder isn't a life-ending thing. It's just a starting point. It's a way to better understand yourself, and then find like behaviors and tools and resources to help you better manage life. Like we all have to, right? No one's immune from needing to do that. Yours just happens to be a little bit more specific. Is there anything else that I'm missing? I guess the last thing is, like, I would encourage you to maybe stop reading about it for a little bit. Yes, I know I just said earlier that, like, I encourage psychoeducation, and I do, but there's almost like this tipping point where we're learning and learning. It's good. And we're like maybe picking up on some tools and techniques and tips and better understandings and oh my gods and all that stuff. Good. But then it can become like an obsession where we're almost looking for more and more and more validation for the fact that we believe we have this thing that we can't really afford to get diagnosed for. And it almost like takes over too much of your life, when I want you to be living your life. And instead of focusing on just like reading about it and listening about it, like, instead, we engage in conversation with others who have that diagnosis and see if there are some tools and techniques and resources we can utilize to make our life better. Because I just don't want you spending all your time reading about it, listening to podcasts, watching videos, without working to improve the things that sound like they were upsetting to you. And then approaching family and stuff like that, give yourself time. If we don't feel like it's a safe place, you don't ever have to tell people. That's your own business and nothing's going to change. You've always been the same person that you are. I know we have this kind of belief that, well, I've come to this realization, everybody needs to know about it. Not necessarily. They can if we really feel like that's what has to take place for us to feel authentic and feel connected, but maybe not, you know? And so pick and choose who you want to share this information with. And the issues that you said that you realize you'll never overcome, like, that's why I'd really encourage you to get into therapy. But again, groups of people who have, an ASD diagnosis, maybe they have some tips and tools in there that could help you see the light and not feel so beat down or grief-ridden with this potential new diagnosis. Okay? Let's move on to question number 3. This question says, hey, Kati, what inspired you to become a therapist and how did you get started? I want to thank you for your incredible work. Your videos have helped me overcome anxiety and overthinking, bringing more peace and clarity into my life. I'm so glad. Your kindness and wisdom make such a difference and I'm truly grateful. Please keep inspiring and helping others. You're changing lives. Oh, just really made my day, this comment. So thank you. What inspired me to become a therapist? The truth is, and if you've been a long time viewer, you've probably heard this story multiple times, but overall, when I was growing up, probably like a teenager, I'd say like middle school age, like 6th, 7th grade, I really took pride on being the secret keeper with my friends. Like if they were going to share something with me, I first of all felt so privileged to be the one they'd share it with, right? Everybody wants to be in on all the gossip and all the dirty deets. And I took such pride in that. And then I was also like a vault. I felt very like if people were going to entrust me with their secrets, I felt it was my duty to hold those secrets in the utmost confidence. And I just really loved doing that. And I know that sounds really silly, but it was maybe a year or two later when I entered high school, and one of my friends at the time was like, oh, they're opening a psych class. Like it was like the first or second year they had a psychology kind of 101 or introduction to psychology class. Remember, this was in high school, not college. And she was like, I think you'd like that because you like love listening to people and you like to talk about what makes us do what we do. And she was right. I was very much I'm what they call an old soul, which really just means you had anxiety growing up. But I definitely would spend nights as a kid, like journaling, thinking through everything. And I'd been in therapy since actually probably started around high school, like my freshman year of high school, I think is when, or maybe it was middle school, but I was about 15. So I guess freshman year of high school. Yeah. Anyway, and I was just completely infatuated with the topic, with people, with figuring out what makes us tick and why we do what we do. I just found it so encouraging and so interesting. And unlike anything else that I had ever like studied or learned about, I wasn't bored by it. You know, some things you like learn about, oh, this is the type of bird and the genus and the whatever. I'm like, ugh, like I just wasn't interested. Math, I was good at math, which I know is like, they say women aren't good at math. I think that's just lies and bullshit. But I was really good at math, but I just didn't really find it interesting. I was bored immediately. And so that's where it started. And then when I started practicing, I actually, for those of you who don't know, I had a really close friend of mine growing up, actually two, and learning later in life, there were 3 of them, close friends who had eating disorders. And because of that experience, I didn't think that I wanted to work with eating disorder patients. I thought it'd be too close to home and it would like be kind of, I don't know, triggering or just cause me to, there'd be transference within the therapeutic relationship. So I've been kind of reluctant or resistant to looking into that and was trying to find jobs in other places. But it turned out the only opening when I was looking for internships was at an eating disorder treatment center. And so I talked with my practicum advisor in school at Pepperdine and told her what I was thinking. And she's like, give it a try. Try it for a month. And if you feel like it's too close and you're too, upset by it and it's just too essentially like disturbing to me, then we'll find you something else. And so I tried it and I fell in love with it and I found it incredibly rewarding. And I think having that background and that history kind of gave me a leg up, but it also showed me all the ways I like kind of fucked up as a friend. I'm like, oh, I shouldn't have said that to her. And like, that's not helpful. And I shouldn't have compared her body to mine. What were you thinking? And, but it was like, she couldn't see what I saw and then I just didn't know. It was ignorance, to be honest. And so anyways, it became the most rewarding work that I've ever done. And that's what led me to create my YouTube channel. And so I just really feel like it was all kind of the timing. It was what was supposed to happen. And yeah, and then you can thank Sean for the YouTube channel because it was his idea. So, and I was not all about it, I'll tell you. I was reluctant at first. And there are some pieces of what I do that are still not ideal. Like I don't love like sometimes the haters and trolls on the internet, but by far our community and the connection that I feel with each and every one of you it always outweighs that other garbage. So anyway, that's just a little bit about me. Let's move on to question number 4. This question says, how could I know if I have ever been in a dysthymia-like state, provided that I don't recall myself as a happy kid or teenager, but someone feeling depressed and suicidal on and off, maybe for a year or 2? Now, dysthymia is, for those who don't know, I know it's a very bizarre sounding word and it's hard for people to pronounce sometimes, but dysthymia is really what we call a low grade depression. Now, I'm not saying low grade to be like it's not impactful and it doesn't feel like shit. It's just, it doesn't meet the criteria for major depressive disorder because dysthymia is kind of what I would call like this low grade, like malaise, or if you watched Inside Out 2, it's like the ennui, just can't be bothered, don't like anything, don't enjoy stuff, feel kind of lethargic and down for most days for a year. And so for a lot of people, we don't have these intense, like people who have dysthymia are often like what I call like high functioning depression. We can tend to like keep up with our life and job and friends and things like that, but we just never really feel good. We don't really feel that joy or that lightheartedness. There's always kind of this like weight on us or this feeling. So I hope that helps make sense of that. Sorry, I don't want to get off track too much. Now, back to the question. They say, I'm 25 now, and in hindsight, my first depressive episode was at age 15 due to an acute stressor. But I tend to think that my personality or character hasn't changed much since a very young age. Through the following years, I've had quite a few distinct depressive episodes and was diagnosed with MDD, okay? Which makes perfect sense. Yet I still somehow find the good time in between had a fleeting, almost phantom-like feature. I was happy with my friends, of course, but as soon as we parted, I was back into the default muted mode or a tranquil mood, but in the sense of like a tranquilizer. I love this question because dysthymia isn't talked about enough. I actually just reached out to a psychologist. I'm hoping she'll be on the podcast. That's her specialty, is like dysthymia, high functioning depression, stuff like that. So hopefully we can get her on. Fingers crossed. Now, if we never felt, excuse me, like a lightness, if we never really felt like we enjoyed things, if we never felt, I guess, genuinely happy in a way that extends outside of us just interacting with someone, because the thing about interaction with other people is like being happy with friends is that a lot of times that can be us kind of performing for them or putting on masking, right? Just to participate and not be a downer, right? Like a lot of us we don't want to be that Debbie Downer. And so we kind of get it up for people and try to pretend that everything's fine when we don't really feel that way. And so if you've never had that kind of lightness, the enjoyment, the like, I hate to just say happiness because that's so like esoteric. Like, how do you know if you felt happy? You're like, yeah, I probably felt happy. But you said you don't recall yourself being a happy kid or teenager. And you felt depressed and suicidal off and on for maybe a year or two. To me, that sounds a lot like dysthymia. And so I would let your therapist know. I would ask them, I would tell them that you suspect that even though you have major depressive disorder now or MDD now, you think that you've had dysthymia like for most of your life, and just see what they say. For a lot of us, it's hard to even know what it would be like without some symptoms of depression. We can feel like, I don't know, like we don't even know what it would look like, feel like, what our life would be, how our life would be different. It's like, I saw people say this, I think it was, I don't know if it was one of the last podcasts or one of the last videos or posts, but I was talking about the miracle question in solution-focused therapy. When you wake up and everything's better, like, how would you know? Tell me. And a lot of you are like, I wouldn't know what that is. And that can be because we've had this like low-grade dysthymia essentially ruining all of our life experiences so that we don't even know what that would look and feel like. So let your therapist know. And I guess if you just don't ever feel light and cheery on a random day when maybe some things go your way, could be dysthymia. Although right now it sounds like it could be MDD, which would account for that as well. I hope that makes sense. I know that's kind of roundabout, but we had an add-on to this and it said, I also had my first and worst depressive episode and suicidal phase when I was 15 and have been in therapy and other treatments off and on ever since. I'm 31 now, and I feel like my depression has been part of me for so long that I don't know who I am without it. I'm working on attachment stuff and self-hatred due to childhood emotional neglect in my therapy, and I keep saying that I want to get better, but I'm not sure I know what that means because I was a kid before it all started. How do you know what to work towards when you don't really know what an adult life without depression feels like? I guess this is very common. First, I want you to know that when we've had something in our life like depression, anxiety, anything, you name it, when we've had that in our lives for so long, we can forget or maybe don't have any memory, don't even know what it was like before those symptoms presented themselves. That's very normal, okay? How are you supposed to know something that you can't remember and that you don't even really know how to describe? You can't. And so there's a couple of things, I have a couple tools and tips that I think will hopefully help you. Number one is let your therapist know about this. Ask them to help you describe it, help you figure it out. Maybe they'll tell you a little bit about like, what would it be like? What am I working towards? Maybe we try to work on that miracle question. We make shit up until we can figure it out, right? And we talk it out with our therapist. I'm not really sure. Is that what it'd be like to be happy? And then, so that's just kind of what I would call like doing our internal detective work with the assistance of our therapist. We're trying to see what we maybe do know that we don't realize we know. And we're using our therapist as like a bouncing off point of like, well, I think people who were like happy wouldn't think of killing themselves, right? That seems obvious. Okay. So maybe I wouldn't feel that anymore. And then maybe when I'd go places, I'd actually enjoy myself, right? We can ask these kinds of questions that we assume that's what it's like to not feel depressed, but we don't really know. And have your therapist work with you to figure out what that really looks like and what are reasonable goals for us to set. Because I can tell you some of mine would be for you to not have any suicidal thoughts for certain amounts of days and to slowly change over your internal dialogue to a less negative place. I would also have you try new things to see if you enjoy them and maybe you didn't know that you enjoy them. I might even have you try to get good at something like building mastery so you feel more confident in yourself because that can help improve our mood. I might try all sorts of things like that. So talk to your therapist about that. Now, the other piece and another tip here is kind of to do what I would call like external research. So the other's more internal. We're trying to like figure it out on our own. But external is, I want you to watch and actually share this in my upcoming book, Why Do I Keep Doing This? You can pre-order it now on Amazon, by the way. Link is in the description. Now, I'm so excited. I'll also be doing a book tour. Very exciting. But the external research part is like we can watch television. Honestly, it might be helpful to watch like reality TV is super emotive, but also like Law and Order or any kind of crime show because people are down and out and bad things are happening to them. And I want you to watch one of those shows and try to identify some of the emotions that those people are experiencing. Or maybe we watch like a happy film, like, I don't know, something that turns out really well. Like I'm trying to think of like, I don't know, The Holiday comes to mind. Or I don't know, Princess Bride, like any kind of movie, and try to identify some of the emotions in the characters that we see and how we know that those are those emotions and how we think, what we think about that, right? Like, and I know you're like, Kati, how does this tie to like, what am I working towards? It's just you getting better at identifying these different life experiences. And then when we've like watched those shows, those movies and all that stuff, then we can be like, hey, I want to feel like that. And I want that to be more what my life is like. And I'd like to have that kind of relationship, right? We can kind of pick out these key pieces within this film or TV show or whatever. And those can be certain goals. And we can talk with our therapist about it and reference it. And they can go watch and find it out and be like, okay, I see what you're saying. But I think that's all really helpful information. And then it's something that we came to on our own and not something that was kind of like forced upon us. Does that make sense? I hope so. Let me know if you have follow-ups. Happy to keep talking about this. Okay. And they said, how do you know what to work? Okay. Hopefully that helps you. Okay. Moving on to question number 5. It says, hi, Kati. I hope you're having a great day. I am. I hope you're having a great day. It says, my question is, how do I ask my therapist for touch to ground me when I dissociate? I have a history of childhood sexual abuse that happened from my mom from 6 to 12. And I have a fear that I can have a panic attack because I have panic disorder. Okay, fair. I tend to dissociate a lot in session, which makes it hard to progress when I can't stay present. Totally understandable. I have BPD, which doesn't help as I'm attached to my therapist and wish that she was my mom. That happens a lot with those of us with borderline personality disorder. I just don't want her to think that I'm weird, disgusting, or dirty. Look at those shame thoughts. Whew, coming in hot. So I don't want her to think that about me for asking for touch. What can I do or say to not feel uncomfortable or weird during my session when asking? Thank you for everything you do as you bring joy to my day with this podcast. Oh, I'm so glad. I'm so glad. And I plan on doing these old school style a little more regularly. It's just, we're just getting into the new groove with more interviews and things like that and trying to line up other creators and other professionals and all that stuff. Okay. Now, asking your therapist to touch you to help you when you're dissociating, is honestly fairly simple. Okay. And whenever we ask our therapist for something, they're going to have follow-up questions. Okay. So prepare yourself, because as therapists, part of what we do is, instead of just assuming, we seek to understand. Meaning that if you ask me for touch, say, Kati, when I dissociate, it'd really be helpful if you could just like put your hand on my arm to help bring me back. That's the quickest way to bring me back from dissociation. I'm going to ask, okay, so you say arm, where on your arm? Has anybody else done this for you before? How would I know if this was something that happened to be more triggering or caused more dissociation? Like, we would talk it out a little bit so that I fully understand what you're asking of me, like where on your arm, being very specific. How would you let me know if it wasn't comfortable anymore, right? We want to make sure we protect you emotionally when we're trying this tool to help bring you back, if that makes sense. Okay. Now, the way that you ask it is very simple. Like, hey, when I dissociate, the main thing that helps me ground and come back is just someone like touching me on the shoulder or the upper arm. And you have to be specific. Tell them exactly where, like somewhere here or here. I had a patient that only liked it on the shoulder. It couldn't be down the arm and it couldn't be on the back. Everybody's a little different. So tell them where and how. And I would even let them know, if you can. I have a lot of shame thoughts and beliefs that come up when I even think about asking you for this. And you could even do your own journaling about that too, because I'm curious, like, why asking for touch makes you weird, disgusting, or dirty. Like, how do we tie those in? And if the roles were reversed and you were the therapist and someone asked you, would you think the same thing? Why or why not? There's something in there to like tease out. However, especially childhood sexual abuse definitely has those like shame thoughts automatically, especially the disgusting, dirty, weird, like feeling like something's wrong with us, right? And so I'm not surprised that is coming up, but I would keep it simple. Practice. You can write down what you want to say. Again, just know that your therapist is going to ask questions, not because they don't believe you and not because you're weird, disgusting, or dirty, or any of those things. None of that. It's because they want to be clear and they want to make sure that they're on the same page with you. And there's no way to not feel uncomfortable when we ask for stuff like this. We can prepare ahead, right? Write it down, say it out loud ahead of time and like practice it. But sometimes in situations like these, we have to be uncomfortable or scared or whatever and do it anyway. Because it's in that practice, it's in that pushing through. And yes, I know it's hard and we can feel like every fiber of our being wants to run the other way. But if we push through and we do the uncomfortable thing, we do the thing we're afraid of, we teach our brain, it actually wasn't that scary. It wasn't as uncomfortable as I thought, or that uncomfortable feeling faded pretty quickly, right? We're like disproving what I would call is like an abuse response or a shame response, that like something's wrong with me. I'm so weird. I don't want to ask about this. It makes me feel so. If we do it anyway, we prove to ourselves, hey, that was okay. And it gets better and better and better the more that we do it, so much so that we can take that out into our regular life and start asking for things that we need and speaking clearly and standing up for ourselves, all which are big key pieces when we're healing from something like childhood sexual abuse. So I wish I had some tools to be like, this will make you feel not uncomfortable. We can make it better slightly, like 10% maybe, by writing it down, practicing it, saying it out loud, all that stuff. But at the end of the day, we have to just be scared and do it anyway. Okay. I'm sorry. I know that's kind of a shitty answer, but I don't want to lie to you and be like, this will make it better. It won't. Some things are just uncomfortable when we try to do them for the first time in a healthy way. Moving on to our final question. Question number 6 says, hi, Kati. I've been in some form of counseling and therapy since I was 12. I am now 32. 6 years ago, I was diagnosed with BPD, or borderline personality disorder, and I've been having private DBT. Now, DBT stands for dialectical behavior therapy. Okay. I've been having private DBT therapy for the past year, as it is not available on the NHS. Oh, that's the national healthcare system in the UK. I've recently had an in-depth comprehensive psychological formulation assessment. That's a lot of words, right? Which I paid for privately, and have been told that I have a dissociative disorder as a result of complex childhood trauma. I'm not surprised. Dissociative disorders are really common when we have childhood trauma. It wasn't a diagnostic assessment, so I don't know which dissociative disorder I have. Oh, what? Well, how could they tell you that you have a disorder but not which one? That doesn't make any sense to me. My question is, I'm still having DBT, and although I really like my therapist, I've gotten to the point where I'm wanting to explore my childhood traumas. There are a lot of them. I'm not sure if I'm technically ready for it, as I've been cycling in and out of crises for about 6 months. Lots of self-harm and suicide attempts. We'll talk about this. My therapist always brings our conversations back to discussing and integrating skills. That's very DBT of her. I know that this is helpful for stabilizing me when I'm dissociative and while I'm waiting for a diagnostic assessment, but how can I tell her I want our sessions to be less skill-based? I'm also really worried about making her feel guilty or like she hasn't helped me, and I don't want to disappoint her or let her down. I'm sorry this is so long. It's okay. It wasn't long at all. Okay. A lot to discuss here. Now, if we are actively in crises, like in a crisis, like I know a lot of you are like, what does it mean to be in a crisis? When we feel like what's happening in our life and the things that we're going through is just too much for us to manage. We're barely hanging on. We're going in between, like in this case, this person said, lots of self-harm and suicide attempts. Those are not good times to switch things up. That's a time for us to essentially do crisis intervention. That means more support, more check-ins, utilizing the resources that have helped us in the past. And once we've gotten through, I guess once the crisis has passed and we've been stable, meaning none of these for at least a month, there's no real timeline on it. When you feel like you're better in your routine and things, again, we're not in crisis anymore. We're not feeling completely overwhelmed. That's when we could start to shift things. Okay. Because being in crisis and changing things is only going to make it worse for us. Now with your therapist, you're not going to offend her at all. Okay. The best thing that we can say to our therapist is something to the effect of, while the skills have been really helpful for me, I would also like to start talking about my childhood traumas because there's so many of them. And I feel like they're really, running my life right now / ruining my life. And I'd like to start processing through them. Now, because this person does DBT, I don't know if they do other types of therapy, like non-skill based. Some people who do DBT are very strict. It's like the same with cognitive behavioral therapy or CBT. They do only that. Now I'm hoping that that's not the case and they're more like me where they do a variety of things. But let them know, I love the skills. This is almost like the hug and roll, one of my favorite techniques, where we say something nice that's honest and a compliment. I love the skills. They've been incredibly helpful and honestly life-saving. However, and then we roll away and we say, but I'm hoping to get into my traumas a little bit more and I'm needing kind of less skills and more talk therapy or more trauma-based things that aren't skills. You're not wanting just homework. You're wanting, there'll be homework, but you don't want it to be more so rigid like DBT is. That's not going to make her feel guilty. That's very normal. I feel like every therapist out there could probably nod along with me and be like, yeah, we sometimes we kind of expect patients to ask for different things or need different things at different times. And so it's really good. And they'll probably be extremely proud of you for asking for what you need. And yeah, there is a time and place for everything. Skills only get us so far. I see skills as more of a toolbox that we're putting together. Meaning we gather all these tools that we can use, but having those in our toolbox doesn't mean that we know how to engage differently. It just might be if those are some of our tools. But if all we're doing is skills, I'm like, are we really practicing regular life? Because some skills require us to journal and be at home and jot things down and think about it and meditate and, do mindfulness practices or whatever. How are you doing regular life? When you can't do those things all the time, are there other ways that you can integrate your skills into your life? Does that mean there's behavioral change? Is this the way that we're interacting with other people and communication? We're doing things a little differently because those skills, those interpersonal skills, are going to be much more beneficial. Now I know I kind of went on a tangent, but I just want to say that so that that's very normal for us to not want only skill-based therapy, to kind of want a hybrid. We want a little bit more of the, I want to talk through these tough times and I want to understand how that's affecting my relationships and kind of why I have BPD and am doing this DBT work and kind of all how it all connects and how we can be better tomorrow. And so let your therapist know that hey, I just would like to do this. They're going to be really proud of you for speaking up and for asking for what you need. And I think it's going to be great. And if they can't offer it, maybe they can refer you to someone who can. Doesn't mean you have to stop seeing them, because you can do DBT and other things at the same time. But that might be, the way that we go forward. Okay. Thank you all so much for listening and watching. Thank you for sharing this podcast. It truly does help. You have a wonderful rest of your week. Do your homework, and I'll see you next time. Bye. Okay, Sean.